Well, good morning, everybody, and happy Thursday. We are so excited to have you here for Megan Gibbs' presentation on the Nancy Gelle Hospice Special Needs Fund. Just before we get started here, Megan, do we have a housekeeping, coffee and chat housekeeping slide, I think? See, beautiful, thank you. So just a friendly reminder for folks on the call before we kick things off, just with the overall format of this coffee and chat, it's being held over webinar. And so all attendee cameras and microphones are disabled. So for whatever questions you have, we welcome them. If you can just enter them into the Q&A box up here on your top toolbar, that would be great. Otherwise, I'll put my email in the chat after I'm done with introductions, and you're more than welcome to email me any questions you have, and I will share them with Megan. So before I kick it off to Megan, I'll tell you a little bit about her. Megan Gibbs serves as a social work supervisor at Park Nicollet Methodist Hospital Hospice, Park Nicollet Home Care, and Olivia Hospice. As a licensed independent clinical social worker, Megan has worked in a variety of medical settings, including long-term care, transitional care, acute care, and hospice/home care. She began her career with Park Nicollet Methodist Hospital Hospice in 2006 when she was hired by Nancy Gelle as a social work case manager. In 2012, she became a hospice supervisor. Megan's goal each day is simple: to help someone, and if she can help more than one person, even better. When she's not at work, Megan loves spending time with her 2 teenage children, both of whom play and referee hockey. She also enjoys experiencing as much live music as she possibly can. So thank you, Megan. So without further ado, I will hand it off to you.
Thanks, Abby.
Yeah, absolutely.
Great. Well, thank you all for being here today. We're going to talk a little bit about hospice care, the life and legacy of Nancy Gelle, and the Nancy Gelle Hospice Special Needs Fund. So here we are in hospice. We're out in our cars quite a bit with our hearts attached to the roof of our cars. Hospice care provides support and care for those in the last phases of a life-limiting illness, recognizes dying as a part of the normal process of living, affirms life, and neither hastens nor postpones death, and focuses on quality of life for individuals and their family or caregivers. I think it's helpful to know who pays for hospice. So for a large percentage of our patients, Medicare is the payer, and Medicare pays for 100% of the services that outpatient hospice provides. And we'll talk a little bit more about what I mean when I say that. Medicaid is another payer for hospice care, private insurance and HMOs. Some people do pay privately for hospice care, and sometimes there's a combination of these providing coverage. As far as the core aspects of hospice care, there is definitely a patient and family or caregiver focus. There are, as I said, this is a benefit that's available through most insurance programs. We provide a range of services, including interdisciplinary support and case management, pharmaceuticals, durable medical equipment, supplies, volunteers, and grief support. Where do we provide care? About 50% of our patients live in a private home, whether that be the patient's own home or a loved one's home. About 25% of our patients live in an assisted living facility. About 25% live in a skilled nursing facility. Small percentage might be in a hospital setting. Another small percentage in a residential hospice. And we kind of lump those residential hospice patients in with our skilled nursing facility percentage. The level of care is somewhat similar in that there are nurses, RNs available around the clock for those patients in a residential hospice. So In order to qualify to be in hospice, Medicare requires that 2 physicians need to attest to a prognosis of 6 months or less based on their clinical judgment for a patient to qualify to be in our program. If a patient's illness does not follow the anticipated course, yet there continue to be marked signs of decline in the patient's condition, patient may remain in hospice for longer than 6 months in some cases, as determined by the hospice physician and patient's attending physician. A patient or their representative must sign consent forms for enrolling in hospice. In order for services to be provided, hospice is a choice. Hospice is, however, an intermittent service. Members of the hospice team visit to attend to a specific need. Even at the very end of life, although visits are more frequent, hospice is not able to provide long hours of care. And I bolded this because this is really where the Nancy Gelle Hospice Special Needs Fund becomes very important for some of our hospice patients. When the patient is no longer independent in managing their daily care needs, loved ones or paid caregivers must provide care for the patient, or the patient must be in a setting where care is provided. Hospice is individualized care, and that is why I've worked in a number of medical settings, and this is why I've been here for 19 years. It is my favorite way to be present and helpful to people. The focus of care includes areas such as energy conservation, pain management, easing shortness of breath, encouraging comfort with eating and drinking, calming nausea and vomiting, assessing and treating confusion as able, supporting skin integrity, promoting spiritual and emotional health, optimizing quality of life, and ensuring awareness of and access to community resources and more. We really are doing everything that we can to make sure that our patient and their loved ones are having the most rich and comfortable time while the patient is in hospice. Our team members are many. We have the patient and family or their caregivers. They are number one on the hospice team, the most important people. The patient's attending physician, so that is the physician who has been involved in their care, usually prior to hospice, although sometimes they get on board as the patient's enrolling. Maybe they have moved to a new facility or something, and that is the physician who is responsible for patients at that facility or residents at that facility. A hospice physician who is sometimes the medical director or another physician who's affiliated with our hospice program. A nurse or several nurses, social workers, spiritual counselors, hospice aides, music therapists, massage therapists, grief counselors, and trained volunteers. I'm going to tell you a little bit about Nancy Gelle now. You see a picture of her there. This picture was taken at her retirement party, which was held at Park Tavern here in St. Louis Park. Nancy Gelle was the program manager for Park Nicollet Methodist Hospital Hospice for almost 40 years. She began her career at Park Nicollet in 1977 in oncology, immediately after receiving her degree from nursing from St. Olaf College. Nancy had a very strong connection with St. Olaf College. I could do a whole presentation on that. She pioneered the development of Park Nicollet's hospice program in the early 1980s, and not long thereafter, in 1990, she started Park Nicollet's palliative care program. Nancy also worked with the Park Nicollet Foundation to start the Growing Through Grief program, which offered in-school individual and group counseling to K-12 students coping with the death of a loved one in dozens of schools across the metro. Nancy received many awards in recognition of both her impact with patients and her outstanding leadership over the years, including, I made a list. It is not a complete list, but these are just some examples. I won't read them to you, but I ask that you have a look. So just thinking about Nancy are some of the things that I um, that I think about when I think of her. She was and is beloved by the hospice team and her colleagues across Park Nicollet. She had the most calming presence. She was my manager for 15 years. I knew her for 19, and I, uh, I just to be in the room with her, whatever was going on, I always felt better even just sitting in her presence. I always knew whatever was going on was going to be okay if I could just talk with her. She made time for everyone, no matter how busy her schedule. When she was our manager here, and even after she retired, she consistently put patients and families first. Uh, Whatever the issue, if we were talking about how our program was functioning, uh, always the question was what is best for the patient? And right after, involved also in that conversation was what is the right thing to do? And we were going to make our decisions based on those two things. After 44 years with Park Nicollet, Nancy retired from her position at the Park Nicollet Methodist Hospital Hospice as the Park Nicollet Methodist Hospital Hospice Program Manager in 2021. When she retired, the Park Nicollet Foundation renamed the grant fund Park Nicollet Methodist Hospital Hospice utilizes to provide for the special needs of our hospice patients, the Nancy Gelle Hospice Special Needs Fund, in recognition of Nancy's 44 years of care, leadership, and service. Nancy died in early September 2025, just a couple months ago, and we, the Park Nicollet Methodist Hospice team, we abbreviate it because it gets a little long sometimes, are honored to be part of her ongoing legacy of compassionate, patient-centered hospice care. There we are, putting our big hearts over our patients' homes. So what is the Nancy Gelle Hospice Special Needs Fund? This is a fund established through the Park Nicollet Foundation to address the unmet needs of our hospice patients. These unmet needs might include, but are not limited to, things such as short-term in-home caregiving, short-term residential hospice placement, medical alert services, in-home foot care services, transportation, clothing or shoes, communication aids such as pocket talkers, communication boards, weighted lap pads, specialty equipment, grooming supplies such as electric razors. How's the fund distributed? So there's an assessment that's completed by the hospice social worker who's assigned to each patient. So all of our hospice patients are assigned a social worker at the time of hospice admission. And throughout the patient's time in hospice, their social worker is always assessing for any unmet needs. If within the course of the patient's hospice stay, there's a specific need that can't be met by other means. So we look at insurance, other grants, patient or family savings. If none of those things can address that need, then the social worker will contact the social work supervisor, which is me, to obtain verbal approval to submit a grant request for whatever item or service they feel that patient might need. Now, some items such as pocket talkers, communication boards, electric razors, there's a list there, don't require verbal approval from the social work supervisor in advance. Those are items that are pre-approved. Once a social worker gets verbal approval from me, then they talk with the patient, family, or caregiver to verify that they are interested in receiving that item or service through the fund. If they are, then they actually do a written grant request and submit that to the supervisor, me, along with a link to any items that need to be ordered or invoices for services provided that need to be paid. And then once I receive those items, I forward the invoices, ordering links, statement of approval over to our administrative assistant who takes care of processing those documents and arranging for payment. As far as our hopes for the future for the Nancy Gelle Hospice Special Needs Fund, our hope is to keep it going. We are seeing an increasing number of people coming to our hospice program with little to no support system and limited financial resources, no family or friends who can provide care, and often just enough money to not qualify for assistance. Your resources to qualify for assistance from the county have to be very, very low. This fund allows for hospice team members to provide patients with items and or services that have a significantly positive impact on the patient's comfort, dignity, and quality of life in their last days that would not otherwise be possible. Over 100 hospice patients received assistance from the Nancy Gelle Hospice Special Needs Fund in 2024, and we hope to be able to attend to the special needs of our hospice patients for all the years to come. It is surprising to me to see the number of people who truly don't have a way to get things like clothes that fit when you're dying. Is very common. People lose weight, so their clothes don't fit, or you need different shoes, or people who don't have a way to get, for example, an electric razor. So things like that are, as far as your dignity, your comfort, it makes such a difference to be able to get those items for people. So we hope to be able to do that forever if we can. What questions do we have?
Well, Megan, first of all, thank you so much for your wonderful presentation. And it is very evident just the amazing legacy that Nancy had and will continue to have with this fund. She was a wonderful woman. And I appreciate you sharing not only information about the fund and its impact, but just about her and her legacy. So thank you. We do have a couple questions here. Just one moment. Let's see. Okay, the first question is, has there been an item or service covered by the Nancy Gelle Hospice Special Needs Fund that has been especially meaningful for patients or families that you could tell us about?
I think of a couple that started out during kind of the high times of COVID, but continue on now into today. So when we were all covered up during COVID, a lot of people were having even more trouble hearing and understanding each other when we had masks over our faces. So even folks who typically had fairly good hearing, we're just still having trouble because mouths were covered up, understanding each other. So through the Nancy Gelle Hospice Special Needs Fund, we were able to purchase pocket talkers for our patients we just would give them to them to have not only for our visits, but for visits with their loved ones. And it made such a difference in just so that people could hear and understand conversation through masks. And we continue to do that today, provide pocket talkers to people. And it does make such a difference in terms of, connection with loved ones, and also with when you're talking with your doctor, with your nurse, with your caregivers, for people to be able to feel connected with their world and people they care about. The other example I'll give, again, from COVID times, especially early in COVID, I don't know if everybody remembers this, but skilled nursing facilities were locked down. So if someone was in a long-term care facility and assisted living facilities as well, people were not allowed to visit. So family members could not be with their loved ones. But what was happening was that private caregivers, so people who go out into people's homes and provide care, were still willing to go. They were putting on full PPE, so they were wearing masks and um, uh, face shields, and like it looked like hazmat suits, but full on cover, head to toe, shoe covers, gloves, all the things. But they were still going out and providing care in homes. So with money from the Nancy Gelle Hospice Special Needs Fund, we were be able to provide for people who would not have otherwise been able to afford it, short-term care for the very end, to allow people to be at home with their family with private hire caregivers, so that people were dying with their family, which made such a difference not only to the patient but to the family, so that everybody could be together at the end. And that was just unbelievable. And we would not have been able to do that without this fund. Unreal. And I don't know of any other program that had the resources to give that gift to those families. And we still do that. We still do that today, but not the volume of people that we helped during, because it was, now, of course, things are different and people are able to be together at a skilled nursing facility and other facilities because there isn't that lockdown. But during lockdown, it was a very unique experience. The only way that you could be together at the end was if you were in a home setting. So thank you. I don't know if anyone on the call contributes to this fund already, but if you did in those times, I just thank you so much.
That is beautiful. Thank you for sharing that, Megan. It really speaks to just like how the fund really looks out for those special moments, those sacred moments for loved ones. And so thank you for sharing that. I do have another question here. Could you tell us a little bit more about the impact for the patients and families who receive items or services from the Nancy Gelle Hospice Special Needs Fund? I know that you just shared some from the pandemic, but do you have any other examples about the impact that patients and families have been experiencing from the fund itself and like its support?
Yeah, I would say the fund makes things that would not be possible, the impossible possible. So, from the more expensive things like private hire, a few days of private hire care or a few days at a residential hospice, to something simple like, getting someone an electric razor, or getting someone, we've gotten art supplies for people, someone who was an artist and really used to enjoy that but didn't have any now, but just something to give them the opportunity to enjoy something they used to enjoy again, but would not now have the means to get art supplies or have them. But now with this fund, we could provide that for her. It really is the difference of bringing families together at the end, but also gives our patients this moment at the very end of feeling seen and valued in their last days, in a way that an insurance coverage doesn't do. It really allows us to individualize their hospice care. So it really, when we talk about special needs, that is exactly what this fund is. And the impact is significant. I guess that's what I'll say. And it's so appreciated.
Thank you so much for sharing that, Megan, and for your presentation today. If anybody has any other questions, please feel free to email them to me. But in the meantime, thank you for the work that you do. Just speaking for myself, to work in hospice and to be there for families and loved ones in that, like I said, sacred time, in that really special time, is incredible work. So thank you for the work that you do every day, and thank you for your time today.
It's my honor.
Have a wonderful day, everybody. Thank you.